Hey, what's going on, Duran?
What's going on, Dylan? What's going on, my man?
Hey, not much. I'm just glad to be on now. For those of you tuning in, let me introduce myself. My name is Dylan Jung. I am the Public Information Officer here at Northeast Delta HSA, and I suppose the unofficial backstage host of Transformation Thursday.
Absolutely. Dylan Jung is the man behind the curtain. As many of our guests, or all of our guests throughout the years that we've been doing Transformation Thursdays, they know him as the man behind the curtain. Today is his grand reveal to the co-hosting stage, growing him in his role here at Northeast Delta Human Services Authority. For this episode of
I can't make it
Transformation
quick.
Thursdays, Dylan Jung, my right hand man, thank you for being here with me, man, supporting me and all the things that we have going on at this agency. This has been a great week for us in our department and as an agency as a whole. And Dylan has made sure to keep all these things moving along for us. I've had some challenges personally that I've been dealing with. And for this episode here, this show here, I said, Dylan, man, come on, co-host it, man. Come on in this thing in case I need to bow out. And if I need to tap out, you can continue to carry that momentum. And he's right here with it. So, Dylan, I truly appreciate you, brother.
Hey, not a problem, man. I am no, I am no Duran Tally. Rest assured. But I mean, when I'm invited onto the show, who am I to say no to a master of the craft of speech and hosting and emceeing like Tehran El Tally?
Hey, come on, man. I appreciate that. I appreciate that. Well, listen, guys, we're going to go ahead and get started with Transformation Thursday here at Northeast Delta Human Services Authority, where, of
Mhm.
course, we're just here to ensure that individuals and families can thrive and reach their full human potential. That's right. We do it through mental health, we do it through addiction, through developmental disabilities, and our prevention and wellness services here at the HSA, making sure that we are building a unified region where again all these vulnerable populations that we serve across the 12 parishes of Northeast Louisiana can thrive and reach their full human potential. We got to show some love, give a shout out to our executive director, Dr. Montez A. Sizer, for his vision and his leadership as we have now made it through the last month of our 2024 fiscal year. That's right. We've done a lot of things throughout 2023, 2024 fiscal year. You've seen us touching, moving, and shaking and impacting, shifting and shaping, changing the way people think about the services and this negative social determinants of health and how we can improve population health as a whole. And what you're going to hear on today's episode is just more insight into that. And so, without further ado, we're going to bring out a guest that you've met before, but she is part of our team on this side of the agency, and that's the special assistant to the executive director, Mrs. Richardra Robinson.
Welcome to the
Hello,
program. Welcome back.
everybody. Thank you. Thank you. I don't feel like a guest anymore. This is my home. I feel like I'm at home,
That's
not a
right.
guest anymore. I'm part of
Hey,
it
you've
now. I'm
taken this
part of
plunge
the
before.
team.
You've sat down with us and we've all talked this out. Is that welcome back?
Well, thank you. I'm glad to be back in the house.
Absolutely, absolutely. Richardra, tell us what you guys got going on over in your Department of Special Initiatives. We know you've been doing health literacy, you've been doing financial literacy, and this week you have an event called Empower Your Wellness. Tell us about that.
So this week we are having, well, actually tomorrow we're having what's called a lunch and learn, where we want people to empower your wellness. Hence the title of our event tomorrow, which is obviously is going to be during lunch at 12 o'clock noon. But this event really focuses on increasing the health literacy of the public. So we will have professionals in the agency speak to those while you're obviously eating lunch and learning about basically increasing your health literacy. And health literacy is having the ability to not only find information about your health, have access to information about your health, but also use the information that you find to empower yourself to make good decisions, not only for your own health, but the health of your family. So that's the goal of tomorrow, is to basically empower those who are in attendance and letting them know how they can increase their health literacy.
That's
Wow.
awesome. That's awesome. I think that's a subject that a lot of people in this region, especially, can really relate to because seeking the advice of any professional, whether it be a medical professional, a mental health professional, that could be a really scary process when you know something's wrong with you, but you don't know who to turn to. You don't know how to ask for help. And even when you do go out and seek that help, you may not have all of the right tools within your tool belt to ask the right questions and like figure out, okay, what are the next steps I need to take? Is that kind of what this is about?
Yes, definitely. And I'm glad you brought that up, Dylan. So, I mean, there are two factors to health literacy. There's the personal health literacy, and then there's organizational health literacy. Well, the first thing that we needed to do at HSA was to ensure that where we are as an agency with health literacy. So back in March, what we did was we trained the staff. It was an all-day training on and health literacy. We wanted to ensure that uh, the staff was on the same page in terms of delivering exceptional customer service to the ones who we serve. That's part of one of our three tenets of HSA, exceptional customer service. So we wanted to make sure that they were doing that. We also wanted to make sure that the health professionals were on the same page in terms of delivering information. Were they speaking on the level of the patients, not using medical jargon that they don't understand? So that was the part of that training where we wanted to let the staff know, hey, or when they are coming to visit us at their visits, are we making sure that they do understand what we're telling them? So we taught the teach back method. We taught the share method. We wanted to make sure that everybody who sees the people who walks through the doors of Northeast Delta Human Services Authority understand what it is that we are trying to convey to them when it comes to their mental health or their physical health. So yes, so Dylan, so yes, tomorrow, because as an agency we are on the same page, we want to let people know when you come in or when you do see a doctor, whether it's within our realm or outside, that you know what kind of questions to ask. Don't feel afraid to bring someone with you that can kind of understand a little bit better than you in terms of health. So yes, those are the things that we will let people know to do, to ask questions. And I bring up customer service because that was part of the training with our staff. We want people to trust us. So if we don't have a friendly smile when they walk in the door, then are they going to be able to let us know what's really going on with them? Because we hadn't gained that trust. So that was part of the training with the staff, that we need to garner the trust of those who we serve. So, tomorrow that's something we're going to talk about. We're going to encourage people to always ask the right questions. And that's what we are here to do, to empower people.
Absolutely. And that's so important. A lot of times, when we think about our own personal health, when you work in a healthcare industry, you may rest your certifications back on the time stamp in which you got those certifications. Terminology, pop culture, society will introduce new terms and new ways of saying things, doing things, and there becomes a disconnect of communicating between the professional now and the client or the community. And so being able to be in the now, be in the know of how to reach and attract individuals, first from us, from professional provider, service care provider, to constituent. But also what I love about what tomorrow is about is open to the public, so that the public can also know, hang on, I don't have to have a PhD. I may not even have to have a GED, but here are some key words or key phrases that I do need to know and I can learn on how to help my doctor understand my pain points.
Mm-hmm. That's exactly what that is. And even those with PhDs, they sometimes have trouble. I know, with my mom, she has a PhD, but some things she doesn't quite understand. I mean, that doesn't, because that's not her realm. So yes, you don't have to be the most educated to not understand some things when it comes to your medical prognosis or diagnosis. So yes, that's definitely what tomorrow is about, to understand and help you get that information to better your wellness.
Absolutely.
That's great. So we're talking a lot about tomorrow, talking about empowering your wellness, this health literacy event. So what kind of things can we expect to see tomorrow?
So tomorrow, I'm so excited about it. Not only, of course, we fed lunch tomorrow, but there will be, we will have our mobile health care unit on site.
Okay.
So during the registration, you had the opportunity to ask it was asked if you wanted a health screening. So those who did sign up for that, ability to see our beautiful health mobile unit. It will be in the parking lot of Tower Drive. So they will be doing basic health screenings in that unit. So those who are in attendance, you will get to see if you are well physically, make sure your blood pressure's in check and all of that. So that is going to be one of the major things that we'll have available. But of course, you will get information from our presenters tomorrow. We will have General Pharmacy there who will be representing the pharmacy side of health literacy to make sure that, you know, the things that are given are in plain language, not so difficult. We'll have someone there representing the pharmacy side of health literacy. We will also have someone there speaking about insurance and private insurance and government insurance, Medicare, Medicaid, understanding what a copay is. So what a PPO, all of that. So that's what you should be able to expect tomorrow. So it's a lot of things we're going to try to fit in with the time frame that we have, but we're so excited about tomorrow's event.
Absolutely. It sounds like a lot, but what I love about this, and I love what I loved about your explanation, was that this course covers so many facets of what you experience in the medical or mental health or the healthcare system, from insurance to just pharmacy to visiting a doctor. But what I love about this, when you're bringing in all of these experts and you're giving people the tools they need to better understand their health, that they can also go to the mobile unit directly outside the class and then practice what they've learned in a very short time span, in real time.
Mm-hmm. Yes, everything will come full circle. That is awesome. Yeah, yes, that is full circle. So everything will become full circle tomorrow.
Absolutely. And so tell us again where it's at and what time does it start?
So so tomorrow's event will be at Tower Place, which is on the corner of Tower and North 19th. So the address is 1500 North 19th Street. It will be held at on the 7th floor of that building. So the 7th floor ballroom at 12 o'clock noon.
Awesome, awesome. That's in Monroe, Louisiana, everyone. 1500 North 19th Street, 7th floor ballroom, Tower Place. Empower your wellness. Richardra, what else can we expect throughout the rest of this calendar year from health literacy?
So you will expect, well, let me just say this too, and I failed to mention that. So we also, as an agency, we developed a manual on health literacy. It's a page manual that will be available to the public. And that training manual basically is what it is. It's a training manual. It was our training that we developed ourselves and presented to our staff. So everybody from all over, not just in Monroe, we'll have that available. So it is a training manual that will be readily accessible to anybody who wants to do their own health literacy training. We have developed a model for that, not only in this area, but all over the world. So we'll expect further coming months. Well, we will have more trainings just like this for the public, for those who are not able to attend. This won't be the last event. We'll also at some point have a health fair. So this is not something we're just doing one and done. This is ongoing. This is our health literacy Empower Your Wellness campaign. So we will have a slate of events later on in the year. So stay tuned for that.
Awesome. Awesome. Well, we're certainly looking forward to it. And thank you, Richardra, for your time on today. I'm going to let Dylan Jung close us out and see what his outro is like.
Putting me on the spot, are you? Well, Ms. Richardra, I just want to thank you for joining us out today on Transformation Thursday. Thank you all for tuning in and coming to learn and learning how to empower yourself and gain that knowledge in order to better manage your own health and understanding. And remember, the Empower Your Wellness Health Literacy Lunch and Learn is going to take place at 1500 North 19th Street in Monroe on the 7th floor of Tower Place. And you can learn more about that at anydeltahsa.org. What do you know? I found it.
As always, we encourage you all to follow the Phoenix on all of our social platforms. If you or someone you know are struggling with addiction, mental health, developmental disabilities, or prevention and wellness, give us a call, 800-256-2522. We're covering the 12 parishes of Northeast Louisiana. Follow the Phoenix. Till next time, Transformation Thursdays. Blessings and peace.
Bye. Thank you.